Hello, my name is Alex, and today I'm going to be showing you all how to perform tracheostomy care. First things first, I knock on the door. I ask him if I come in. He says yes. I come in. I provide the patient privacy. After that's done, I perform some hand hygiene. I then introduce myself to the patient. Hello, sir. My name is Alex. I'm going to be your nurse for today. After that's done, I use 2 patient identifiers on the patient, and then while checking his wristband. After that's done, I now tell him I'm here. I tell him the reason why I'm here is because I'm here to do tracheostomy care. I then ask him some questions, says he has any problem with that. He says no, and he gives me full permission to perform the care. Now, first things first, I'm going to put my patient in a semi-Fowler's or Fowler's position while doing this procedure. After that's done, I perform hand hygiene, and I put on a clean pair of gloves. Now that's done, I now get my tracheostomy kit and begin to prepare it. Remember to make sure to open it away from me. After that's done, I get the clean sheet. Make sure I only touch an inch of it. And now I set it up right over here. Now I then get the rest of the contents of my kits and I dump it gently onto the sterile field. Now, with the leftover contents of the kit, I get my solutions I need, which are hydrogen peroxide half and half normal saline, and the 2 other containers are regular normal saline. I put that in there, and now that I'm all set up to go, I can now begin. I now will begin to take out the tracheostomy from the patients. Now while doing this process, it's important to do this very gently. Like so. Now that that's done, I now put in the half hydrogen peroxide for it to clean. Now, right after that, I now remove the dramped or dirty trachea dressing. Discard it, like so. Now I take off my pair of gloves and discard them in the trash. Now then I perform hand hygiene. And after that's done, I now will put on my clean pair of gloves. My sterile gloves, if you will. I first put on the first glove on my dominant hand. I then put the last one on my non-dominant hand. Like so. Now that that is done, I can now begin grabbing my brush from the kit. And now I'm going to get the tracheostomy that's been sitting in the solution, and now I'm going to be cleaning it. Also gently. Put this in the normal saline, discard this. Now that this is 100% clean, I now am going to reinsert it back into the patient. Nice, slowly. Without hurting them, like so. Now that that's done, I will get some Q-tips and put in a normal saline and clean around the tracheostomy site. Discard, get another one. Discard. I then get clean, dry gauze and dry around the tracheostomy site. Make sure there's no wetness. Reason why we do this: make sure there's like no like crust around the tracheostomy site, which can lead to infection. So that's why we do this. That's done. I discard this. I now get a new clean tracheostomy cloth and put it underneath like so. Just like that. Now that that's done, the next step is to get rid of the old straps that were around the patient's necks with brand new clean ones. Okay, like so. Discard this in the trash. Now, usually while doing this process, I would have an assistant nurse with me. Discard that. Now when we're doing this, gotta make sure we gotta tie this around. Like so. Now when you're doing this, you gotta make sure you're not hurting the patient in any way. Now on the side of this, I'm going to do a little knot on the side of the patient. And when I'm doing this knot, I'm going to make sure it is away from the patient's skin so I don't hurt them. Now that that's done, I'm going to get a gauze pad, a clean gauze pad, and put it underneath, put it in there so the tie does not rub against the patient's neck and cause a pressure ulcer. Now that's secured like that, last thing I have to do now is get some tape and tape it. And make sure when you're taping it, it's not on the skin. So, it's on the tie and the dressing, not the skin. Like so. There you go. Now that that's done, I put the patient, now that that's done, I discard my sterile gloves, throw them away. I clean up my entire space, discard this all in trash. I then perform hand hygiene. Once that's done, I put the patient in a comfortable position like so. Now that that's done, I make sure he's comfortable. I ask him a few questions. I give him his call light. And I tell him, okay, sir, this is your call light. Whenever you need anything, just press that call light, and anyone will be here to help you out. And I ask him if he has any questions. He says no. So now that is done, I'm gonna go away now and perform and do some documentation of the procedure.